We all know the saying, the eyes are the windows to the soul. That's why we put so much effort and detail into getting the surgery of the upper eyelids and lower eyelids done right. We have our beautiful model Stephanie here, and we have some anatomy drawn on her face to help guide through the education of what we talk about. I see a lot of patients who come in, they're not ready for a facelift, but they really want to do things that make them look bright and happy and give them the confidence to go out into the world and feel like they're projecting the way they feel. And that's where we really zone in on the details of the position of the eyebrows, the position of the upper eyelid skin, the fats of the lower eyelids, the muscle tone of the lower eyelid, the volume loss through the cheeks. So we can take a multi-layered approach, not just superficially, to really sculpt things and make them look the best they possibly can. So today I want to go through what we talk about during our consultation for eyelid rejuvenation. Patients come to me often and just say, my eyes look tired, I don't feel tired, how can I make them look refreshed without changing their shape? And we'll look at the upper eyelid and how that relates to the brow, as well as the lower eyelid, so everything stays in harmony and balance, because that's what makes a pretty result. Let's talk about the 3 layers of the eyelid. So first there's skin. Underneath the skin, we see this orbicularis oculi muscle, thin muscle that acts like a purse string to help us blink our eyes and close our eyes. But below that muscle is the 3rd layer, which is where all the fats lay. And you can see on the lower eyelid, there are 3 little fat pockets. One here, one separate pocket here, one separate pocket here. And on the upper eyelid, there are 2 pockets, one here and one here. And these 5 pockets of fat are independent of the fat on the rest of your body. So whether you gain weight, lose weight, it's really not going anywhere. Those fat pockets are there to protect the eyeball from banging up against the bones of your eye socket. So when I'm looking at someone's face, we start looking at the upper eyelid skin. And you can see there's over that fold there, as we age, that skin will start becoming excess and folding over. And when we do that, that makes the patient an excellent candidate for an upper lid blepharoplasty. Upper lid blepharoplasty has been around for ages, but it's having a resurgence. People are very interested in doing the upper blepharoplasty again. What we do there is you make an incision, close your eyes for me, right where the skin folds over itself, completely hidden in this crease and a little past the corner of the eye. And through that incision, you can open your eyes, we can remove the excess skin. Once we remove that excess skin, we'll see the 2nd layer that's just underneath the skin, and that's these muscle layers here. And you can see here we have drawn out the muscle called the orbicularis oculi muscle that goes all the way around the eye. It acts like a purse string to close the eye. And then there's the frontalis muscle here in the forehead, and the corrugator muscles here that we treat with Botox to get the 11s to go away. And once we remove the skin, we'll see this red muscle underneath. And a lot of surgeons will then trim that muscle to take away a little bit of excess, you can close your eyes, right through that area too, to show more eyelid. But I do not like doing that because it can cause more hollowness. Even though it shows more eyelid, it can look more aged when you do that. And it can have functional problems down the road. So we really avoid removing that excess muscle. Underneath the muscle are fats. This is the 3rd layer. And you can see on the upper eyelid, there's a pocket of fat here that sometimes bulges. There's a pocket of fat here that sometimes bulges. And there are 3 pockets of fat on the lower eyelid. And then on the outside corner, there's this gland here, the lacrimal gland, that makes tears for our eyes. So we want to make sure we leave that alone. And we really want to leave that fat in that 3rd layer alone on an upper blepharoplasty as well, because we don't want to hollow out your eyes. But for some people, this nasal fat pad, the one very close to the nose, does bulge over time. And that fat is independent of the fat on the rest of your body. So whether you gain weight, whether you lose weight, it's not going anywhere. So oftentimes we'll make a little hole inside the muscle so that we can get to that little pocket of fat, and we tease out a little bit very conservatively and trim it out, and that fat bulge will go away. And that's how we treat the upper blepharoplasty. So what are hooded eyes? Hooded eyes come from 2 things usually. It's excess skin of the upper eyelid, as well as a brow that's pushing that skin down more. So oftentimes you need to treat both things to unravel the hooding. So what do? We do an upper lid blepharoplasty where we cut out the excess skin over the eyelid, and then we do a temporal lift where we make an incision behind the hairline here and lift the tail of the eyebrow up just a little bit. Those 2 things are often married. You can't separate them at a certain point. So the best way to treat hooded eyes is by removing the excess skin and unraveling the part that's folding over, kind of like an accordion. So although it's great, there are some candidates that are truly just an upper blepharoplasty. Be prepared to come in and discuss with your surgeon what are all the things that are really going to make it look natural, harmonious, and balanced. And they'll do a comprehensive look at everything for you. Whenever we rejuvenate the upper eyelid, we really have to look at the lower eyelid as well to make sure that things are harmonious and balanced. And oftentimes when there's aging in the upper, there is aging in the lower. And what do we see there? Sometimes we see excess skin, but we also see shadows. And the shadows are what really make us look tired. And the shadows come from two things, the bags. Fat pockets. 1, 2, 3 separate fat pockets on the lower eyelid. That is, again, fat that's independent of the fat on the rest of your body. Whether you gain weight, lose weight, it's not going anywhere. And those fat bulges can bulge out and create a shadow. Oftentimes right underneath this bone of our orbital rim, you'll also see fat being lost in the fat pockets here in the tear trough underneath the cheek. And that can cause a trough. So when we have a big bulge and a low trough, the distance between those two makes a big shadow. So to really fix it, we have to bring the bulge down and fill the trough up. So what are the different ways of doing that? Some surgeons cut through the skin, cut through the muscle to get to the fat, then they cut out the fat and tighten everything up. Here's what I hate about transcutaneous lower lid blepharoplasty. It can pull the eyelid down. What does that mean? There are 3 layers to the lower eyelid that we're treating when we're doing surgery. There's a layer of skin, then there's a layer of muscle right underneath there, and then there's the deeper fats that we need to manipulate when we're doing surgery. Oftentimes, surgeons will cut through the skin with an incision and then cut through the muscle of the lower eyelid to get to the deepest layer of fats. But every time you're cutting through that muscle layer here, you're increasing the risk of pulling the eyelid down because you're affecting the tone of that muscle. So for my surgeries, I never touch that muscle layer. We don't want to manipulate it. We don't want to cut it because that can have consequential effects of pulling the eyelid down. So how do we do it? We treat the deepest layer, this fat layer, with something called a transconjunctival blepharoplasty, a very cool, scarless lower lid blepharoplasty. We don't go through the skin. We don't go through the muscle. We go from inside the eyelid, find these little pockets of fat, and either we trim that fat out that's bulging, or we tease that fat out and re-drape it down into the trough, which is ideal. But sometimes that fat isn't enough to fill up the trough. That's why oftentimes we're doing fat transfer at the same time, where we take fat cells from your abdomen or your inner thighs, we spin them, and then we inject that extra fat, like we're sprinkling little seeds in a garden, to fill in the rest of the trough. So again, to treat the eyelid bags, you have to do something to reduce the bulging fat around the eye and fill in the hollowness underneath. Then if we need to treat the skin, we just make an incision on the skin, but sparing the muscle underneath, and just trim off a little excess skin. So we've treated the skin layer, we've treated the fat layer, but we've left the middle layer of muscle all alone. And by doing that, we've really protected your eyelid from any pull down or ectropion. That is a key to beautiful surgical results with little complication. So that's how we treat the upper eyelid, lower eyelid complex together with a temporal lift to look rejuvenated and still like yourself. Here are the things some surgeons do that can change the shape of the eye that I hate doing. When I do lower eyelid and upper eyelid surgery, I want your eyelid shape to stay the same. I don't want to change it unless there's a deformity there to begin with. So surgeons can make oftentimes mistakes. What they can do is some people will do a lower eyelid surgery where they cut through the skin of the lower eyelid and the muscles of the lower eyelid, and that can lose tone and make the eyelid droop down. Oftentimes surgeons will cut the ligaments in the corner of the eye here to do a canthoplasty unnecessarily, and that can cause webbing and can change the shape of the lower eyelid. That can also pull the lower eyelid down. So we prevent lower eyelid collapse from not doing a canthopexy unless we absolutely need to. We don't cut the muscle of the lower eyelid so we don't get the eyelid pulled down. When we do an upper blepharoplasty, we take the right amount of skin, so we're not causing tightness that's going to change the shape of the upper eyelid. When we do a brow lift, we're not aggressively overlifting and trying to change the shape there either. Also, when patients do fat transfer, you really have to go to somebody who has expertise in doing fat transfer around the eye. If you go somewhere and they're not injecting it properly or slowly enough or with great delicate care, you can get bulging through these areas that can also change the shape of the eye. We can use that fat to sometimes support the eye for people who already have sag, who've come to us from another office, but we really have to be conservative with the way we do our fat transfer to not change the shape of the eye. So as facial plastic surgeons, we can do a lot of things to manipulate the position of the eyebrows. Sometimes we can do those things with Botox, sometimes we can do them with surgery. So let's break down how those work. In our practice, we have two ways of resetting your brow so that it looks bright and happy but not overdone. One is called a temporal lift. And a temporal lift is about taking the tail of the eyebrow and lifting it a little bit, kind of like what Botox does. And we use that oftentimes with our facelifts or with our upper blepharoplasties as an adjunct surgery. What we do is we make a little incision behind the hairline. It's a little access incision. We don't shave your hair, we don't cut your hair. And it's just an access, and it allows us to go into the deepest layers and lift from the tail of the eyebrow to the cheek here and put in a couple stitches to lift that brow up. Again, it's not a brow lift because it's not doing any of this, but it does smooth out the skin of the temple area and lift the tail of the eyebrow up. It's a great procedure. We do it often. It doesn't require any staples. It's just stitches and looks wonderful. Sometimes we need to fix the heaviness of the brow that's a little bit more in the center of the eyebrow or the inner part of the eyebrow. And that's where we do an endoscopic style 4-point brow lift. It's the same as the temporal lift, same incisions here and here, but now we're going to add two more access incisions. One along the hairline here horizontally and one here. They heal great because, again, it's an access incision. We're not cutting out skin, so there's no tension. So what we do is through these 4-point access incisions, we can go deep and lift the eyebrows off of the connections to the bone that are pulling that brow down hereditarily and with aging. And we release that brow, we weaken those attachments, and your brow is naturally going to lift into a better position. Once it does, now we can suture things back into place, not trying to tug it as high as it can go, but to put it and secure it into the position it's passively lifted into. So it's more of a passive brow reset than a brow lift. Brow lifts can be terrible, right? We've all seen them because a lot of surgeons lift the brows in the center part of the eye straight up and down. And that's not the way the brow ages. When you do that, it'll lift the brows up and give you a surprise look. It'll widen the brows and look fake. But that's not the way we age. We age not vertically in the center of our brows, but on the outer 2/3 at about a 60-degree angle. And that's how we lift when we have those access incisions, is up in that direction. So that's what a properly done brow reset will do. Not over pulled, nothing fake, not to unravel all the skin, but just to get the brows into a position where you don't have to use the muscles as much and things look bright and happy like you did 10, 15 years ago. Brow lifts and eyelid lifts are not a cure for needing Botox. Botox is needed to help treat wrinkles that come from muscle activity. When we do surgery on the brow or the eyelids, we're not cutting any of those muscles. We're repositioning things, we're taking the tension off the muscles, but we're not stopping those muscles from working. Some muscles around the eye will pull the eyebrows down. This muscle around the eye is called the orbicularis oculi muscle, and it's a purse string round muscle. On the outer quadrant of it, the outer half here, this muscle is always pulling the brow down. So when we do Botox to this part of the muscle here, it relaxes this muscle and allows the brow to elevate. Obviously, your great injector will know how much is appropriate to elevate to not give you a Spock eye and how to take in other factors as well. Then we also have the corrugator muscles here. These muscles also pull the eyebrows, the inner part of the eyebrows, down. That's why when you get Botox injected to it, it's stopping the downward pull and allows the eyebrows to lift up. Up here is something called the frontalis muscle. And this is the only muscle that works by lifting the brows up. When it contracts, it lifts up. But every time we lift up our eyebrows, we get these deep creases. So you can imagine when you treat the only muscle that's actively pulling the eyebrows up with Botox and stop it, you have a greater risk of dropping the eyebrows down. So that's why some people will say they have heaviness afterwards. That's why it's so important to go to an injector who knows the proper way to evaluate the frontalis muscle and all the other factors to do the injection the proper way. So between neuromodulation with Botox that can manipulate the brow and this forehead wrinkles, as well as brow lifts, we can do things in combination to really get a natural look that looks bright and happy. So what are the adjunctive procedures I do with upper face rejuvenation? Assuming I've treated the upper and lower eyelids the way I usually do, which is an upper blepharoplasty, resetting the brow, a lower transconjunctival blepharoplasty to remove the excess fat bags, and a little fat transfer to fill in the troughs, sometimes I have to do some extra things to the skin to really get a superb result. So one of the things we do is treating the excess skin of the lower eyelid with something called a skin pinch. What we do there is we make an incision right underneath the lash line where no one will see it, and we just roll up a little bit excess skin and cut it out, taking great care not to touch the muscle of the lower eyelid so that we don't have any functional problems. So excess skin is treated with a skin pinch or skin excision. Crepey skin around the eye can't be treated with removing excess skin. Crepey skin is treated with a CO2 laser or a chemical peel, something to resurface it. So oftentimes I'll be doing a CO2 laser all the way around the eye, even the upper eyelid, to tighten up that skin and improve the texture of it so that things look brighter and happier afterwards as well. Sometimes we'll do that in combination. We'll do a skin pinch as well as a CO2 laser. Sometimes people have a very weak lower eyelid that wants to pull down, so we have to do something to support that lower eyelid. There's a stitch called a canthopexy stitch, where we just put in a little support from deep inside so that during the healing period, the eyelid doesn't get pulled down. It's not a manipulative stitch. It's not going to do a permanent change to the shape of your eye, but it gives support so that with swelling, it doesn't go down during your healing period. So if I was to do a brow lift, upper eyelid, lower eyelid, and fat transfer, which is kind of the complete package for upper face rejuvenation, that surgery takes about 2.5 hours to do total. You'll wake up in the recovery room, you'll have a wrapper on your head, it'll feel sore, it'll feel tight, but you're not going to feel any sharp pain. You may have a headache, and sometimes we even give you a caffeine tablet to help that headache go away in recovery. A fast recovery is an important part of your surgical journey. So we do everything we can when we're doing upper eyelid and lower eyelid rejuvenation surgery to make it easy as possible. So what are the things we do that are different that make your recovery a little faster? So first, for the lower eyelids, we never cut through the muscle of the lower eyelid. Muscle is what bruises and swells. So when we can go and do a scarless surgery from inside the eyelid and avoid cutting that muscle, we've really cut down on the bruising and swelling and hastened your recovery. When we do the upper eyelid surgery, we do it with a little bit of heat. That means less bleeding, less bruising, much faster recovery that looks brighter and happier. When we do our brow lifts, we never use staples. So you're not going to feel the pain of the staples during your recovery. They're all going to be stitches that are well hidden. We're not cutting out skin, so there's no tension. So those incision lines will heal well very quickly. We don't require any drains when we do upper face rejuvenation. So that makes recovery a little faster as well. Combine those preservation techniques with things like Elixir MD and all the other things we do, narcotic-free surgery. We've really keyed in on making a faster recovery with less bruising and less swelling to go as fast as possible. So I'm here today with Stephanie, who's one of my OR nurses, and she's seen me do a ton of surgery on the upper eyelid. And she's been a wonderful model for us today to show the anatomy of the muscles of the eye, of the deeper fats around the eye. But I want to ask you, Stephanie, what's it like being in the OR and seeing this anatomy firsthand when I'm operating?
It's one of the most amazing surgeries I've ever seen.
Yeah.
Honestly, yeah. My favorite part is take the little fat pads out.
You can see the change immediately, right?
Immediately.
Yeah.
Immediately see the change.
I think that's what a lot of patients don't know is that we see the result before the swelling's kicked in. And oftentimes Stephanie or the other oral nurses will say, oh my gosh, what a change immediately. And we are proud of that because we know it not only does it look good on the table, but we know it's done the right way. And when it's done the right way, we know it's going to have longevity. And that's what separates our results. So anybody can make something look good immediately. The question is it done the right way underneath with sound technique and philosophy behind it? And that's why we have fun when we're in the operating room and can show off this anatomy. I love to teach. And one of the benefits of going and seeing a facial plastic surgeon is they're really going to be able to do the assessment of your face properly. Patients will often come in and say, my eyes just look tired. I think I need an upper blepharoplasty. And really seek out somebody who does this all day, every day. Because when they do, they can immediately start seeing all the little details. Where's the tail of the eyebrow? Where's the middle part of the eyebrow? What's the distance between the medial parts of the eyebrow? Does this patient have a high forehead, a low forehead? Is there excess skin truly, or is it the brows dropping down? Where are the fat pockets? Is the lacrimal gland sagging down? Do we have true volume loss underneath? What's their skin tone? Is there depth below their skin? All these little assessments are what I'm going to go through with patients during the consultation. That's why when patients send photos, I say, I can't really give you a full assessment until I see you in person. So when we get to do that, we can truly tell what you need and do an in-depth assessment. And I'll tell you what needs to go together and why, and what is an adjunct procedure that you can choose to add or not. But that evaluation is what we take our pride in.